Hello, how are you? Oh, not too bad. Name's Joel. Joel, good to see you guys. Good to meet you. This blustery day. A little bit cold outside. Late spring. Yeah. Hopefully it clears up rather quickly. Yeah. Well, I just kind of want to clarify why we're meeting here today. I wanted to talk with you a little bit and also get some information from you, just kind of clarifying where we have been over the last few weeks with treatment. Is that okay? Yeah, sure. Okay. How do you think the last few weeks have been going with the treatment that you've been receiving from our clinic?
Well, the last few weeks, I haven't seen any progress in my life.
Yep.
That moment. But otherwise, treatments are right.
Okay. As far as your long-term goal for what you want to get out of treatment, what do you think that is?
Well, I think first we have to kind of relook what we're doing with this physical therapy.
Yep.
And maybe make whatever changes are necessary to start making some progress in the therapy.
Okay. Now the exercises I've been having you do at home, have you had success with those, or how are those coming at home?
Well, the ones I can do lying down, I've been doing.
Okay.
But the other ones I haven't because I can't get up to do them.
Okay.
My pain and weakness in that leg is still there.
Sure, that makes sense. Well, I tell you what, our goal is obviously to get you back to functioning as close as we can to what happened, to where you were prior to fracturing the hip. That's our goal, and it sounds like that's still yours well.
Yep.
Now, as far as your intervention or your completion of the home exercise program, you said you're able to do the ones where you can lie down. Pain and weakness.
To get up.
Yeah. Now, is pain and weakness, is that the biggest factor with your
pain is there. It doesn't seem to be a whole lot better for the last few weeks, but
okay.
The big problem is just that leg's not strong enough. I don't have any faith in it.
Okay. Now, as far as the leg is concerned, I know you've been using a wheelchair quite a bit. Now, yeah. As far as PT is concerned, I think we can start putting some weight through that leg. As far as the surgeon is concerned, have you talked to him about what he wants you to be doing with that leg?
Not for a while.
Not for a while. Okay. So, and the reason we're doing this is so we can come all back together. For PT, I'd like to start putting more weight through the leg. That's gonna help with the weight bearing. That's gonna help strengthen that leg. We don't have to put all the weight through it right away. We can do partial weight bearing, and it also will help with some of the pain tolerance. Okay. Now, within your home, you said you're able to do the activities where you can lay down. What can PT do for you to help you accomplish some of those other exercises at home?
Make that leg stronger.
Make that leg stronger. Okay. How motivated would you say you are to make that leg stronger? If you're really motivated, then we can work pretty hard. If you're thinking, I just kind of want to get back to where I can have some mobility, then we'll modify our approach based on that as well. So how motivated would you say you are?
I don't think motivation is an issue.
Okay.
I think the issue is fear that I'm going to fall over and break something else.
Sure. Okay.
I don't have the faith in that leg enough to get up on it and exercise.
Sure. Now, does having, I know you're currently living with one of your children.
My daughter's here.
Yep. Does having her around help with that fear, or does that?
Well, it does because she helps me get up.
Sure.
And she helps me around when she can, but
okay.
She's not helping me with the exercises.
Sure. Sure. Now, does she work during the day?
No, she's retired. She's available.
Okay. Now, has anyone talked with you about ways in which to make your home safer, via grab bars or removing rugs or carpet or making areas more well lit or anything of those nature?
Not specifically.
Not specifically? Okay.
They give you a pamphlet.
Sure. The reason I bring that up is grab bars throughout the home, kind of similar to a railing when you go upstairs. That gives you something to hold on to while you're walking. So that's one option that we can explore that would make the home safer. Getting rid of carpets or rugs, sometimes those can shift on the floor, which can create an unstable surface.
Which cushion.
They also cushion, yep. And we can if you still want the cushion, we can have carpet down, but maybe look at do you have like a longer carpet, like a shag carpet, or do you have a pretty minimal carpet, kind of like what we have in the office here?
A little more than this.
A little more than this? Okay. So that might not be so bad, but carpets or things that you would have to walk around or that would create kind of an unsteady surface, we can do a whole evaluation just to kind of identify some of those areas that you could look at. Would that be something you're interested in?
That's fine. Yeah.
Okay. Another question for you is, do you think having your daughter available to help with some of the home exercises, is that helpful? Does she know how to help you, or would it be helpful to have? I know we're doing home health. Would it be helpful for us to increase our number of visits to help you accomplish those home exercises?
That'd be fine. I mean, the thing I want to do is get that leg stronger. If that's what it takes, and we have, a program that will show some progress there, then that's all right.
Okay, good. Well, this is just kind of as a recap. I know you're concerned about getting legs stronger. I know your kids are a little bit concerned as well because they see you and they want to see you get back to whatever level of function that's possible. I hear you saying that you want to achieve that level of function, but the biggest fear is that falling. And so, as my role as a PT, I'm going to focus on getting your legs stronger. I'm also going to focus on removing anything within your home that may cause some of that fear, whether that's unstable surfaces, a lack of railings. Have we talked at all about giving you a walker? Do you currently use a walker? I know you use a wheelchair, but you have a walker? Do you use it very often?
Well, I can get up out of my chair. So
Okay. So we'll focus on increasing the time with the walker. We'll also focus on increasing the number of visits in order to help build that confidence. Now, with the number of visits, the thing we have to consider is insurance and Medicaid and how they're going to reimburse. But as long as you're making progress and as long as you're motivated and willing to put forth the effort, I don't think we should have too much of a problem with that. And as we start to see improvements, we may scale back the number of visits, but increase some of the exercises, focusing on getting that leg stronger. Does that sound like a good plan?
Yeah, I mean, I need to get that leg stronger so I can do what I need to do.
Okay. As far as any other barriers that may exist, other than the fear of falling, and then just that whole movement from being in bed, laying there, to getting up and having the pain and weakness, what other things do you see that are keeping you from accomplishing your goal of getting back?
The leg's the thing.
The leg is the main thing. Yep. Okay. We'll focus on that. And as we go, I'll be sure to ask for feedback, but feel free to give me feedback as well. Tell me what's working well. Tell me if it's not working well. Because I know we've been doing home health for a few months here. It hasn't really been working out so well. I'm also going to use your daughter to kind of get some feedback as well. She can kind of offer a unique perspective. She's helping with some of the care. She can kind of let me know what works well, when I'm not there as a physical therapist. And be honest with me. If there's something that I can help teach her to help you accomplish exercises, let me know. Or if something didn't go very well with a certain home exercise, let me know as well. And I'll work with you to identify those also. It's not just on you. I'm there to help, but, when I'm not there, keep those things in mind. Does that make sense?
Yeah, as long as I've been doing it all the way.
Yep, absolutely. The biggest thing is your goal to get the leg back and communication between you and me.
Okay.
I want that open communication where you can, let me know, and in turn, I'll be asking for that input as well.
Okay, that's good, that's good.
Other questions for me? Again, this is just kind of a review of where we've been and where we're going, so.
Okay, I think that's it.
Okay.
How do you think you did?
I think it went fairly well. The big thing for me and the big thing within physical therapy is I want to focus on the patient. I want to focus on what your goals are. And I was trying to get at that, and I think that's where we were going. So, do you have feedback you can provide for me?
We were compatible in the sense that we both had same set rules. I wanted, to be able to get around, get the legs stronger. And I saw that PT was the way to do that. And I was glad to hear that you were going to somehow integrate my daughter into this process by teaching her some things that she could help with.
Sure.
What are my fears? I'm asking,
Or your fears?
Yeah.
I would say from our conversation, the biggest thing is a fear of falling. You've had a left hip fracture and now a right hip fracture. So you've experienced this twice. That's obviously going to create some trepidation or that fear. The other thing is a lack of mobility, a lack of independence. I would say that's definitely present.
Okay, we didn't talk about this, but also a great reading.
Okay.
We'll discuss that.
Mm-hmm.
Okay, did a good job, interested, and I think you did the right thing.
Okay.
Sense of training. You don't understand it, appreciate it, it's their plan and stuff to the institution.
Sure.
There are just one or two things that I would recommend.
Okay.
You did an awful lot of talking and you asked a lot of closed-end questions. If you had asked me questions like, tell me about that, you would have got a lot more out of me, we had a lot more information. I also understand from this role that you're here to tell me that the family and you and the other medical folks are supposed to have a meeting to determine what's going to happen.
Yep.
That didn't come up. I didn't mention it. Right. If you had, it would have been a big problem, because I would have seen you as an agent of that.
Right. And that's why I didn't bring it up. The whole reason, my kind of goal was to find out what your goals were, where you saw therapy going, and then kind of let you know my goal as well. I didn't really want to bring up the fact that the family requested, for example, to schedule a meeting with all the people involved, the physician, and all this kind of stuff, because if I don't have your trust, if I don't have your goal of how you want to see things going, it's going to be really hard for me to come back and say, okay, knowing, none of that, not, reviewing the last 4 months or not knowing your goal, let's bring everybody together and tell you what you're going to do. If I can find out what your goals are, find out where you have seen therapy and where you see it going, then I can come back and say, well, this is where we have been. We haven't been very effective. We want to be effective, and as such, I'd like to incorporate your kids. I'd like to incorporate the surgeon. I'd like to incorporate physical therapy and brainstorm as a team to see, how we can progress forward. And that was kind of my approach when I read through the case, is I don't want to talk about that right now. I want to establish, the understanding that we're looking back and then we're looking for the future and what can we change, and then use that team approach as a method of change. And I don't know if that was effective or not, but I didn't really want to bring it up because I knew that would kind of be a...
No way we didn't have enough time for you to get through that entire process for me to understand.
Sure. Yeah. Yep.
The only recommendation that I would make to you is listen more. You told me a lot of things about your motivation and what your objectives were you had to do, most of which are relevant to me.
Sure.
What's relevant to me is that you understand what I want, and that you can explain to me how we're going to achieve what I want. did a good job. Didn't do too much,
Sure.
too much verbal stuff.
Okay.
Did a good job.
Thank you so much.
Thank you. Thank you.
Appreciate that.